Welcome to the 2021 Preseason Aquatic Facility Safety Meeting. Thanks for joining us online again for this year's safety meeting in the effort to prevent the spread of COVID-19 as we prepare for this year's swim season. So let's kick things off by meeting your friendly neighborhood health inspector. If you have a pool or spa or aquatic facility in North Richland Hills, you're going to be dealing with one of the three lovely people on the screen. And if you can't remember who your health inspector is, just email consumerhealth@nrhtx.com. That's the email at the very bottom of the slide. And all three of us have access to that email, so we'll be able to get you straightened out if you contact us at that email. Our emergency number is also at the bottom of this slide. It's the 24-hour non-emergency dispatch for North Richland Hills. So if it is after business hours or on the weekend and you run into an emergency, let's say a car drives through your pool fence or you have a near drowning, feel free to call that number and one of us will get to you as quickly as we can. So let's talk about why we're here today. It boils down to the three reasons on the slide. We want to prevent people that are using your facilities from drowning, from getting hurt, or from getting sick. So during this class, we're going to talk about how to prevent drownings and other types of injuries on your property, what's new with aquatic facilities in Texas and in our area, and we'll review what you're required to do by ordinance in NRH in regards to your permitted aquatic facility. We're here because Texas and Tarrant County have a drowning problem. It affects both adults and children, but drowning is the second leading cause of death for Texas kids. And since 2011 to March 2nd of this year, 2021, 839 children have fatally drowned in the state of Texas. That's over 800 kids in 10 years. And the consensus is that we're leading the U.S. in the numbers of fatal child drownings. We usually tie with Florida. And out of Texas, which is leading the U.S., Tarrant County is leading. We usually tie with Harris County down in South Texas. And the tragedy is that every one of those fatal drownings was preventable. And anywhere from 20 to 25% of them happened in an apartment, hotel, or HOA pool. So by paying attention to the things we're going to discuss in this class, you're going to make it less likely that someone on your property is included in those numbers moving forward. And you all have a very important role to play in preventing drowning and preventing people from getting hurt on your property. Most of the rules that you're required to follow are based in best practices for drowning and injury prevention. We call them the layers of protection because drowning is not something that can be prevented by taking one step. We can't say, hey, teach everybody to swim and then nobody can drown, because even if you know how to swim, you can still get hurt, you can still get tired, stuff happens. So drowning's really difficult to prevent because you need multiple steps in place, multiple safeguards to keep people safe. And that's why we call it the layers of protection. You're trying to layer on as much protection as you can around people so that they either don't have the possibility of drowning or you have what you need to rescue them in time before there's some negative outcome. And you guys are going to recognize a lot of the layers of protection that are in this graphic. It's things like a fence, safety signage, safety equipment like the ring buoy or the shepherd's crook so that you can rescue somebody, safe drain covers, that kind of thing. And those are your responsibility to provide for your property. And one thing that we would really like to see is that everybody familiarize themselves with the ABCs of drowning prevention. That's the graphic on the left side of the screen. It's basically the layers of protection repackaged in a way that is easy for anybody to understand. You can use this to educate visitors and residents on your property about how to protect themselves and their family from drowning. And when they protect themselves, they're also protecting you from those negative things that can happen. You guys are not alone in this. You have an enormous opportunity to get the word out to people about this problem, and we have resources to help you. The website on the right that's on top is NRH Water Safety 365. That's the city's drowning prevention website. And we have the graphics for the layers of protection and the ABCs of drowning prevention on that website for you to share. There's some flyers and posters that you can hang up. There's a rhyming storybook about water safety that's also a coloring book that you can download and print out. It's aimed at kids and teaching kids about water safety, but it also has a lot of information for parents included in that book on how to protect their family. There's lesson plans for childcare age kids. There's a lot of good stuff on there. If you haven't seen that website, really recommend checking it out, because we'll talk to people when we're on your property. If we see something, we'll talk to residents and try to educate them, but we're only there once a month for maybe an hour or so. You guys are there all the time. You're going to see when there's a herd of 10-year-olds that doesn't have an adult in sight, hanging out at one of your pools, and you're going to know how dangerous that is. You're going to be able to see if there's kids in the water and the adult isn't paying attention and doesn't have eyes on them. And you're going to know that drowning's completely silent and quick, and be able to get some kind of message across that might save somebody's life. The website at the bottom, nrhtx.com/aquatic facilities, that's the consumer health website for public pools and spas. That's specifically for you guys. And we have put a ton of resources on there for you. We have an opening checklist that is basically our inspection checklist. And when you're ready to open your pool or spa for the season, you can look at that checklist and go down line by line and make sure that you're good to go before we ever show up. We also have water chemistry logs that we've already made for you. If you don't have any or you want something more robust, feel free to use ours. They're on there. And there are a lot of fact sheets and handouts that we've found useful over the years to hand out, things that we've created because of questions that people have asked. If you haven't checked out that website, also a really good one to check out. So I want to just roll through the ABCs of drowning prevention briefly and walk you through each one. The letter A is for active adult supervision. And we say active adult supervision because drowning is totally silent. It doesn't happen like in the movies when there's a lot of screaming or splashing when somebody's drowning. A person who's drowning, they can't scream or splash. So there's almost no noise at all when it starts to happen. And it happens so quickly, guys. In less than 2 minutes, that person is gone. So it's really important that when kids are in the water, there's an adult that has eyes on them. They're not distracted by cell phones or talking with parents or doing something else. They have to have eyes on those kids in the water so that they don't miss that crucial moment that they could step in and save that kid. And one of the best tools for this is going to be the Water Watcher tag. We have a lot of these that were given to us by Safe Kids North Texas and Cook Children's Hospital. If you want some for your property, just reach out to us and let us know. But in the picture, you can see that the adult is wearing a card on her wrist, on a bracelet. That's the Water Watcher tag. It basically says, when kids are in the water, I'm the one that's responsible for watching them. And it's great when you're having a pool party or multiple people using the pool, because one adult can wear this card and keep eyes on kids in the water for 10 or 15 minutes. And then at the end of that 10 or 15 minutes, they switch that card over to another adult, and that adult becomes the water watcher. So this is a concept that we want you guys all to be familiar with and encourage on your property to help protect people. Let's talk through some more of the ABCs. We just talked through active adult supervision. The letter B stands for barriers. So this is things like your fences and your gates to keep kids from getting to the water when they're not supposed to be. You have to make sure that your fences are in good condition and that they're secure. And you have to make sure that gates and doors and windows that lead to water are closed. They're self-closing, self-latching. A kid's not going to be able to run up and just open that gate or door and get to the water when nobody's watching. This is important for you guys. Make sure that if you're in the pool enclosure and you're working on something, or if your landscapers go in to do some work inside the enclosure, that you close the gates and the doors behind you. Don't leave them propped open. This is a surefire way to get in trouble with your health inspector, and it's also really a bad idea because some toddler could pull away from, their adult that they're with and go straight into the water, and nobody would know until it was too late.
Letter C is for CPR and lessons. We really recommend everybody on your staff know how to do CPR. If it doesn't come in handy in the pool yard, it will come in handy somewhere else on your property. I guarantee it. And we always say even the best swimmers can benefit from swim lessons. Making sure that everybody in your family knows how to swim is awesome. We have swim lessons at the NRH Center for kids to adults. So, check that out. D is for devices. That refers to life vests, and when we say life vest, we mean a U.S. Coast Guard approved life vest. So something like the puddle jumper is U.S. Coast Guard approved, but the floaties or water wings that you put on the arms, they're not, because they're not life-saving. They can come off of the arms and that kid can drown. It's not going to keep that kid's head above water. Safe drain covers are also a part of devices. We recommend that as part of your daily checklist that you look at your drain covers, make sure that they're still there, that they're not broken, and that you can see them every day. And other devices that you're required to have are your safety equipment. That's going to be your shepherd's crook, your ring buoy, your float line if you have a pool that goes from shallow to deep, and your backboards if you're a lifeguard facility. And E is for everyday. Because Texas has a very long swim season. It has a wide range of temperatures. We could be swimming in March or we could be swimming in October, depending on how the weather cooperates. One last resource for you guys. Regionally, we've joined with Cook Children's and Safe Kids North Texas to be part of their Lifeguard Your Child initiative. They do a lot of regional messaging that we join in with, and they have this really cool program called the Water Safety Club. If you send your residents or your visitors to the website up there, they take a short class on water safety, and then every month Cook Children's gives away free stuff to them. So they could get free life jackets or free CPR lessons or door locks or things like that that might help protect their family from drowning. Drowning is a huge problem in our area, a crisis that we need your help to address. But as we all know, it's not the only crisis we're dealing with right now, right? We're in year 2 of dealing with COVID-19. The pandemic's not over yet, and we're still trying to get it under control. But the good news is, per the Centers for Disease Control, there's no evidence that COVID-19 is spread through the water in pools, hot tubs, water playgrounds, PIFs, and other treated water aquatic venues. So as long as you're properly operating, maintaining, and disinfecting your water, you're going to remove or inactivate the virus that causes COVID-19. And when we say disinfecting, we're referring to the standard safe water chemistry of chlorine or bromine that we're all used to using. So that's good news, but we're more worried about coronavirus spreading because of people gathering around your pool and spreading the virus to each other, and from people picking up the virus from surfaces around your pool than through the pool water itself. And at this point, most of us are familiar with the methods that are proven to slow down the spread of coronavirus, including staying 6 feet apart from others, increasing ventilation, having everybody wear a face covering to prevent the spread of aerosol, cleaning and disinfecting surfaces, especially high-touch surfaces like doorknobs and light switches, and properly and frequently washing our hands. But one of the best resources out there for you is the CDC guidance for aquatic venues that you can find by going to the website on the bottom of the slide. We really encourage you to review these recommendations and continue following good public health practices as we move forward into swim season. And another way that we can put COVID-19 behind us is to get as many people vaccinated against COVID-19 as we can. So if you're interested in getting your vaccine, it's free. I have a couple of websites at the bottom of the slide that are going to be really useful to you. The top one is the registration site for Tarrant County. If you want to sign up and get your shot from Tarrant County, go to that website on top. They're the largest vaccine provider for Tarrant County right now, but there are other providers that are starting to come online. So the website below that is the state website that lists out all the people that are providing vaccine across the entire state of Texas. And we're currently in phase 1C of vaccine distribution because supply is limited.
So you're eligible to receive the vaccine if you're a healthcare worker, if you're a resident of a nursing home or long-term care facility, if you're an adult aged 50 years or older, or if you're an adult of any age that has an underlying condition that would make COVID-19 worse. So think high blood pressure, obesity, diabetes, things like that. If you or someone you know begins showing symptoms of COVID-19, you can register for free COVID testing in our area by visiting one of the websites on the screen. The top website is for Tarrant County as a whole, and the bottom website is the Curative website. Most of the free testing sites offered by Tarrant County go through Curative, and that includes the one at NRH2O, that's the closest one to us here in North Richland Hills. It's really easy to register, really easy to do the test, and you get your results back in a couple of days. It's not a bad thing to have in your back pocket. If you have any more questions about coronavirus, please check out the good information from Tarrant County Public Health at coronavirus.tarrantcounty.com. They also have a coronavirus hotline during business hours for questions or concerns. The Texas Department of State Health Services also has some good information on their website, which is listed in the second space. You can talk with DSHS staff if you have questions or concerns about coronavirus by dialing 211 on your phone and then selecting option 6. And their hotline is open from 7 a.m. to 8 p.m. 7 days a week. We also wanted to share Tarrant County Small Business Development Center's website for you. They have a huge list of coronavirus resources, and they are grant funded, and their staff will offer free financial advice to small businesses. So really worth checking them out too. One last plug before we dig into all things aquatic. Mosquitoes are already starting to emerge in our area, and with mosquitoes come West Nile virus and other mosquito-borne illnesses. Last year was a really active year for West Nile virus. Texas had 69 cases and 15 deaths from West Nile, and it's possible that we'll have another active year for West Nile virus and other mosquito-borne illnesses. So we want to remind everybody how important it is for you, your staff, and your residents to protect yourselves from mosquito bites. You can protect yourself from mosquito bites by following the 5 Ds. They're listed on the screen, and they are dress, drain, DEET, dawn and dusk, and doors. So dress just means you wear long sleeves and pants when you're outdoors. Makes it a lot more difficult for mosquitoes to chew on you. Drain means that you look for and you either drain or treat standing water on your property. If you have standing water on your property and you're not sure how to address it, feel free to reach out to any of us at Consumer Health. We'll help you the best that we can. And if you see any standing water on public property, make sure that you report it to us so that we can take care of that from our end. The third D is DEET, and it's a little misleading. What we really mean is use an EPA-registered insect repellent. It used to be that DEET was the only EPA-registered insect repellent, but now there's several different types out there, including oil of lemon eucalyptus and picaridin that are based in natural products. Personally, I like to use picaridin because it doesn't leave that weird odor and greasy feeling. But we really need you to wear an EPA-registered insect repellent. It keeps mosquitoes from biting you. Make sure you wear it on the outside of your clothes or on your skin directly if it's exposed. The fourth D is dawn and dusk. The mosquito that spreads West Nile virus really likes to be active during dawn and dusk. So if you can avoid being outdoors at those times, you're going to avoid a lot of those mosquitoes. And the fifth D is doors. And what we really mean is check for and repair gaps in doors and window screens to keep mosquitoes from getting into your house. All right, moving on. Let's talk about some of the things that have changed since last year. One of those changes is that Texas has officially adopted the 2018 International Swimming Pool and Spa Safety Code statewide, and it's in effect for the state as of September 2020. You can find this code at the website at the bottom of the slide. This code was developed by the International Code Council and the Association of Pool and Spa Professionals. It applies to both public and residential aquatic facilities, and it's really focused on construction and design of swimming pools and spas. This code really applies to you if you're building a new pool or spa, remodeling your pool or spa, or replacing equipment, or if you're making any repairs to your existing pool or spa.
It does not generally address daily operational standards. In addition to the 2018 International Swimming Pool and Spa Safety Code, Texas also adopted new and additional rules for public pools and spas statewide. And if you're watching this video, you're considered a public pool or spa. Now, this new code contains rules for both construction and daily operation of public pools and spas, so it's going to affect both new and existing facilities. It's the first statewide rule change for public pools in over 15 years, and there are a lot of changes. I included a couple of quotes from Texas Department of State Health Services on this slide, and you'll see the quote towards the middle says, "Existing facilities are not subject to the new requirements regarding engineering and construction except as specified in the rules. However, other requirements such as water quality and user safety apply to all facilities upon the effective date of the rules for this subchapter." So the code went into effect January 1st, 2021. It's already in effect. And there's several changes that existing facilities need to make now. Existing facilities won't fall under the engineering and construction rules until they change something. So as soon as you change your deck or your drains or your equipment, you'll likely be required to come into compliance with the new code. And before you do any of that, we really recommend that you talk to one of us before you make any changes. One of the many new changes required by the new codes is that there are many new signs required in the pool and spa enclosure. There are about 8 new signs required for pools and about 8 new signs required for spas. I'm not going to get into the details of this, but the easiest thing that you can do is go to our website, it's at the bottom of this slide, and find the handout that says Aquatic Facility Signage Requirements. And that handout goes into detail about what these signs are, what they need to say, how big the letters need to be, all of that good stuff. If you have any questions about it, ask your health inspector. We are really encouraging everybody to get the new signs in place before the swim season begins so that you're ready and you're fully in compliance beforehand. That's what we're pushing for, but if you run into problems or questions on this, reach out to us and we'll work with you. There are also changes in the new codes that affect water chemistry at swimming pools and spas. And we've made a handout for you called Water Chemistry Levels that can be found at the website at the bottom of the screen. We really encourage you, print that out, take a look at it. The state added limits for combined chlorine, oxidation reduction potential or ORP, alkalinity, calcium hardness, algae. They're requiring that water be balanced, and the frequency of testing for different facilities has increased for most facilities. So take a look at that handout. Let your health inspector know if you have any questions about it at all. So let's talk about water balance. One of the biggest changes to the water quality standards is that the water chemistry has to be balanced. In the past, we've really focused on water chemistry levels that affect health and safety. But water balance goes beyond health and safety. It goes towards not just health and safety, but also to protecting your equipment. And we're going to talk a little bit more about what that means. An operator has to make sure that water chemistry is balanced at least once every 10 days. Water balance is important because it tells us whether the water is too acidic or corrosive, or whether the water is too basic or scaling. And what I have for you is 2 pieces of equipment on the screen. The equipment on the left was exposed to water that was too corrosive or acidic. And you can see that that acidic water etched out the inside of that equipment. Acidic water will eat the inside of your equipment. It will eat your plaster. That's why it's bad. And the equipment on the right was exposed to water that was too basic or scaling. And when water's too basic, it will allow minerals and different kinds of things to accumulate on the inside of your equipment and on the inside of your plaster. So you can see either way, whether the water's too acidic or too basic, it causes damage to your equipment and to your pool. And that's why it's really important that the water be balanced. And there's lots of ways to tell if your water is balanced or not. One of the easiest ways to do it is through the Langelier Saturation Index. Most swimming pool and spas, the operators like to use this. I have the formula and some of the factors on the screen if you feel like doing it by hand. But there are a lot of tools that you can use that will help you if you don't feel like doing it by hand. So when we say balanced water, what we mean if we're talking about LSI is that the ideal range is between negative 0.3 to positive 0.3. You're going to plug numbers into that formula, and as long as it's between negative 0.3 and positive 0.3, the water's balanced. You don't necessarily have to do anything to protect your pool or protect your equipment. If you're really not feeling up to doing a bunch of math and calculating things out by hand, there's a lot of tools available to you. And to throw it out there, your health inspector is also available to you. If you have any questions about how to calculate water balance, just reach out to us. We'll be happy to spend an afternoon with you explaining how to do this and how to use whatever tool you decide to use to do it. One of the best tools that you have when you're trying to figure out water balance comes in your test kit. Most people use a test kit, and if you're using a Taylor test kit, they have a watergram water balance calculator inside the test kit. It's that little wheel that's made of paper. If you've ever wondered what it's for, this is what it's for. You move things around on the wheel and it automatically calculates water balance for you after you've found your temperature and your total alkalinity and those other levels. So I have a YouTube video that I've found that really explains how to use this well. I encourage you to watch that, and if you have any questions about how to use it, reach out to your health inspector. You can also find a ton of online calculators that you just plug in the values that you got for total alkalinity, calcium hardness, temperature, all of that good stuff, and it will spit out the number for you at the end and tell you whether your water is balanced or not. And there are several apps out that will do calculations for you if you're a pool operator. Orinda has a pretty good app for LSI. The National Plasterers Council has an app that costs $4 that will calculate this for you. That's probably the best one that I played with when I was researching this. So look into those tools. If you have problems using them or you need help, just reach out to your health inspector. We'll teach you how to do this. When you start to look at your water balance, you're going to get your water unbalanced eventually. And you're going to run into the situation of trying to figure out what to fix first. So when that happens, this slide is here just to kind of give you some guidance of what to do when it happens. The first thing to remember is that we're still focused on pH, disinfectant, which is free chlorine or bromine levels, and cyanuric acid. Those three parameters are what are important for health or safety. If those aren't in the acceptable range, it's not safe for people to swim. So you always have to make sure that you get those into an acceptable range before you do anything else. But once those are in the acceptable range and they're stable, if your water's still unbalanced, the next parameter that you want to focus on is total alkalinity. Address that next if you're trying to get your water back in balance. And when you address total alkalinity, address it first and then let it sit for a day. Don't try to address alkalinity and pH and calcium hardness and everything else on the same day. Buy what you need to get the alkalinity up or get it down. If you have any questions on how to do that, reach out to your health inspector. Wait a day and then try to address some of the other factors. Right? If you've addressed total alkalinity and your water's not balanced, the next parameter to focus on is pH. And this is only if your pH started in the acceptable range of 7.2 to 7.8. Okay? If you address alkalinity and pH, water's still unbalanced, then go to calcium hardness, and from there, other factors if you need to. By that point, you probably won't need to. If you're stumped, contact your health inspector. When we look at the new pool code, there's some things that we can look at and we can say, yes, existing facilities need to do this and they need to start doing it right away. So the water chemistry changes, the signage changes for the most part. We can say, you need to start doing that right away. There are several things in the new code that are more in a gray area. And we really recommend that you look at your facility, talk with your insurance company and your in-house counsel, and make sure that you're doing what you need to stay in compliance with the most current code. By and large, whenever you start changing something at your facility, you're going to have to come into compliance with the new code. So before you change equipment, drains, decks, fences, anything like that, make sure that you talk to your health inspector first. Once you start remodeling, repairing, or especially building something new, you're going to have to think about these new codes and what you're going to have to change to come into compliance with them. We have created a plan review checklist that takes both the new state pool, public pool codes and the 2018 International Swimming Pool and Spa codes into account and NRH ordinance and combines them into one sheet so that you can evaluate those things in one place. It's on our website. Look it up. If you have problems, talk to one of us. One of the gray areas for the new codes is accessibility requirements. So the new code talks about accessibility for pool and spa decks, and it very clearly says that once you renovate or repair a deck, you have to come into compliance with accessibility requirements for persons with disabilities under federal, state, and local fair housing and disability access laws. That's one of the things that you really need to start looking at now. And there are a lot of new rules for spas in the new swimming pool codes. We really recommend, if you have an existing spa, get with one of us or look at the new codes to see how your existing spa may fall short of the new codes. Most of these come from 2018 International Swimming Pool and Spa Safety Code. A couple of the new codes that we know about are that if the spa is using an automatic chemical dispenser, you also have to have an automatic pH and ORP or oxidation reduction potential controller working in concert with the chemical dispenser. This requirement makes sense because the spa doesn't have a lot of water. If you start injecting chemicals into the spa, it doesn't take much to really throw off that water chemistry and possibly make it dangerous. That controller is just a backup to try and keep your chemical dispenser from dispensing 3 gallons of acid into a spa that might hurt somebody when they step into it. Another rule is that the spa emergency shutoffs have to be equipped with audible and visible alarms now. So when somebody pushes that button or pulls that lever, there has to be both an audible and a visible alarm that goes off. And when you get those alarms in place, there's an additional sign, which is the sign on the screen, that needs to be posted as well inside the enclosure. Basically saying, if the alarm's going off, do not use the spa. This seems like a really good time to bring up chemical interlock safety. And there's a video about this that explains it better than I ever could. I really encourage you to visit the website at the bottom of the screen and watch this video. It's less than 10 minutes long and it's really amazing. I'm not sure why I couldn't get it to work for the PowerPoint, but you're stuck with me talking about this. So if you have an automatic chemical dispenser, this applies to you. Whether it's for liquid chlorine or acid or any other kind of chemical that's automatically getting injected into the flow. Chemical interlock safety means that when the power goes out or your flow rate drops, that the chemical dispenser stops working. Okay, and this is something that your electrician can check for you or can put in place for you. You need to make sure that you have this in place, because a lot of pool chemicals are incompatible with each other. You think acid and chlorine, when they mix together, they create chlorine gas. It can hurt people, it can kill people. It's happened in other places in the country. So make sure that you have this in place. If you have any questions about it,
feel free to reach out to one of us.
Okay, y'all, I know that is a lot of new information to throw at you really fast, but we're almost to the end of the class. This is probably the most important section of the class here at the end, so please kind of wake up a little bit. I promise next year, if we're in person, we're going to play Jeopardy and we're going to eat donuts, okay? But let's talk about what you need to do before you open your pool this year. The first thing you need to do is make sure that one person on your staff is a registered certified pool operator. That means they've gone to the CPO class and gotten their certificate, and then they've brought that certificate up to City Hall to Neighborhood Services and gotten their registered CPO card from Consumer Health. If you have any questions on how to do this, reach out to us. The other thing you need to make sure you do is get an electrician out again to look at your pools and spas and your pump room, fill out the annual electrical inspection form, and have that ready for us because we'll need a copy of it for your opening inspection. Third thing on the list is attend this safety class. After this class is over, complete the 10-question quiz that's on the website and email that back to us at consumerhealth@nrhtx.com. All right, and lastly, pass your Consumer Health opening inspection. It's mid-March, so we're starting to get out and do preliminary pool inspections. The way this works is that your health inspector does a preliminary full inspection to try and find out, is there anything that's gone wrong since last year? What problems do we need to fix before the pool reopens? And we'll give you a list of those things that you need to fix. Once those things are fixed and your water chemistry is balanced, everything's working again, you call your health inspector back out for an opening inspection when you're ready. And after you pass that opening inspection, you can open the pool for the year. Now, all the pool permits expire on April 1st every year. So if you close for the season at all, your gates have to lock and close to residents and visitors on April 1st. If you're open year-round, you have to pass an opening inspection by May 1st. Otherwise, you're going to have to close your doors unless your health inspector says otherwise. If you have any kind of question about this process, you need to reach out to us. If you've taken this class before, this slide is going to be really familiar to you because it's the most important slide of the entire class. If you've been sleeping up till now, pay attention to this slide because you really need to know this information, okay? The conditions on the screen, if any of these exist, it's your responsibility to close your pool or spa and then lock the gates and doors to the enclosure so that your residents and visitors cannot access it. We're going to walk through each one of these conditions one by one, right? So the first one is if your water chemistry is not in acceptable range. And when we talk about water chemistry, we're not talking about calcium hardness, okay? We're talking about the water chemistry that's necessary for health and safety. That's going to be free chlorine, pH, and cyanuric acid. Now, there have been a couple of parameters added in with the rule changes, like combined chlorine, that could be necessary for health and safety. We still haven't quite figured out which ones are going to be necessary or not. But these three, if they're out of range, the pool has to close because it's not going to be safe to swim. First is free chlorine. It has to be between 2 or 8 parts per million if you're using cyanuric acid or stabilizer. If you're not using cyanuric acid or stabilizer, it's 1 to 8 parts per million. Free chlorine is important because it's what's killing bacteria and parasites and viruses in your pool water and keeping them from infecting people that are swimming. Okay. The second health and safety chemistry parameter is pH. pH has to be maintained between 7.2 and 7.8. The reason for this is because at that level of pH, free chlorine is best able to do its job. And also, it's much less likely that you're going to burn somebody's eyes or skin if the pH is in that neutral range. The third parameter that you really need to pay attention to is cyanuric acid. It has to remain less than 90 parts per million because at 90 parts per million, it won't let free chlorine do its job and disinfect the pool water. You're not required to have cyanuric acid or stabilizer, okay? And if you're an indoor pool or a spa, you're not allowed to use cyanuric acid or stabilizer. But if you have it, you need to make sure that it stays less than 90 parts per million. Okay, moving on. If the bottom of the pool or the drains aren't visible, you have to close it. Somebody could get down there and you wouldn't know they're down there if you can't see them. So that's the whole reason that that condition exists. Also, if you can't see the pool drains, odds are your water chemistry is not in the acceptable range. Okay? You also need to make sure that you're looking at your drains and your drain covers every day, because if those covers are damaged or missing or anything damages your drains, it's not safe for people to swim. The pool pump's like a vacuum cleaner, and if somebody gets down there and those drain covers are damaged or there's something wrong with the drain, the pool pump will suck them down onto that drain and they won't be able to come off until the pool pump goes off. So really important, again, if drain covers are damaged or missing, close the pool. If your pool pump stops working, pool or spa's closed. Okay? The circulation equipment's necessary because it helps circulate those chemicals and keep that water chemistry good. If the emergency phone's not working, in most cases, you're going to have to close off the enclosure. There's certain situations where we can allow you to have a temporary emergency phone or have staff out there, monitoring to make sure that if there's an emergency, they can call 911. Just reach out to your health inspector if that happens and it's something you need. All right, if your fence or enclosure has been damaged, you have to secure it. And until it's fixed, nobody can use the pool or spa. Right, your gates and doors, you also need to check and make sure that they are self-closing, self-latching, they're still in good shape. Because if they're not working, you need to lock them and secure them. If your safety equipment is missing or damaged, you have to close until you can replace that safety equipment. So that's going to include your shepherd's crook, your ring buoy with your safety line, your float lines that separate the shallow from the deep end, any of your safety signage, or your backboards. If the emergency shutoff for your pool or your spa isn't working, that's a problem that would require you to close the pool. And we have a catch-all phrase at the end that says any other potentially hazardous condition. That means maybe somebody got a little rowdy on a weekend and threw a bunch of glass bottles into the bottom of your pool. Broken glass is a problem. It could cut up somebody's foot. You've got to close at that point until you can address that situation and get it fixed. Maybe a tree falls into the pool enclosure. Maybe a car goes through it. I feel like knocking on wood while I'm saying this. If any other potentially hazardous condition exists, it's your responsibility to make sure that your residents and visitors cannot get to that pool. So let's look at some inspection photos from the last year as kind of case studies in when you would need to close the swimming pool or spa. Here's one that's from a property that installed an automatic chemical dispenser. And I don't know how well you can see it, but on the left is the chlorine dispenser, and it's leaking. It's leaking very badly at this point, okay? A health inspector showed up for a safety check, and when we opened up the pump room door, you could actually see the fumes get vented out of the pump room. So when it aired out, we were able to take a look and see what was going on. And what had started as a very small leak at the chemical dispenser the week before became a really big leak by the end of the week. And the CPO hadn't been checking on it to see what was going on. Small leaks become big leaks really, really fast. Okay, and that's exactly what happened in this situation. It just kept feeding chlorine through this leak. Nothing was going to the pool, so the controller kept telling the chemical dispenser, yeah, it needs more bleach, needs more chlorine, and filled up the bottom of the pump room floor. The picture on the right, you guys can kind of see where that chlorine ran down to the right side of the pump room, and it's around the acid barrel. Remember when we said that chlorine and acid are not compatible? Luckily it hadn't gotten through that barrel, but there was plenty of other chemical residue on the floor that chlorine interacted with, enough to create some really dangerous fumes. And this is definitely an example of any other condition that would be potentially hazardous and make you close your pool. That chlorine could have off-gassed as chlorine gas, and then when somebody breathes it in, it becomes hydrochloric acid in their lungs and could hurt them. So it was really lucky that the inspector or the certified pool operator didn't get a mouthful of chlorine when they opened that door. Here's a couple of other examples of something we commonly run into that would be considered any other potentially hazardous condition. For whatever reason, sometimes kids or people feel like they need to pull your pool lights out of the wall. And when this happens, it's dangerous because you have that electrical wiring that's exposed. It becomes an entrapment hazard and it becomes an electrical hazard. Somebody could get trapped in that wiring or trapped on that light, and then they're stuck underwater, unable to breathe. Or the GFCI that's required for that light may not work, and somebody could get electrocuted. So if somebody pulls your lights out, please close and lock the pool. Here's another situation we ran into this year, and this one was super dangerous. They were very lucky that they didn't have somebody go into this pool and drown, honestly. The pool was green. The circulation pump had stopped working. And the picture on the right upper hand side was a picture of the deep end. You guys can see, you can't see the bottom of that pool. If some kid got in there and drowned, you would not be able to find them on the bottom of that pool. So very, very dangerous. The picture on the left shows their one gate into that enclosure. And what they did was lock it open. All right? We've seen this a couple of times. Please do not do this. The gate has to latch behind you, okay? Because it's way too easy for some kid to pull away from their guardian and just pull that gate open, and they're going to go right to the water, guys. Never lock your gates open. Never prop them open. And I just wanted to point out one more thing from this inspection. The safety equipment. The shepherd's crook was getting old, and you guys can see on the right-hand side, that's what the handle looked like, all the way down. So let's say some kid did go missing, and we needed to look for them on the bottom of that green pool. That shepherd's crook was not in a usable condition. When the inspector grabbed that pole, it actually cut the inspector's hand when they grabbed it. It wasn't usable. So you want to make sure that the handles of your shepherd's crooks, they're smooth, there's not fiberglass sticking out, there's not tape that's come off and become hardened and brittle. You want to make sure that the hook at the end is connected to the pole, and that pole is non-conductive, which means it can't conduct electricity. All right, and really the message I'm trying to get across, don't forget, if there's something hazardous, you need to close your pool and then post it as closed on the gates and doors. Okay, it has to be locked to residents and visitors and then posted that it's closed. If you guys do this on your own before we show up for a safety check, there's no penalties assessed by Consumer Health. We're going to show up and say, oh, look, there's a hazardous condition there, but you have locked your gates, you've secured your enclosure, you're doing exactly what you want to do. Your health inspector's going to be super happy. They're going to tell you good job. And you're going to avoid any situations that might come out of that hazard that would be bad for you. Okay? The other thing we want to get across is don't change any of your equipment, your decks, your fences, or especially your drains without first talking to your health inspector. And if you're replastering, you don't have to get a pool permit, but we're never going to have our feelings hurt if you call us and say, hey, I'm replastering. Can you come out and look at the tile? Can you come out and make sure that everything looks good? We're going to be happy to do that for you because we want to avoid problems that we can catch on the front end and not have you go back and fix later. All right, just kind of want to put in a plug about drain covers. Don't forget, your drain covers in your pool have a life expectancy. It's stamped on the cover. So if you don't remember the last time you changed out your drains, you don't remember what that life expectancy is, we recommend that you go ahead and change those. It's really important that you use the fasteners that come with the drain cover, or some sort of stainless steel fastener that's not going to corrode at the bottom of the pool. Make sure that you use the right type of drain cover, and also pay attention to the flow rate that's stamped on the drain cover. Every one of your pools has a flow meter built into it that's going to tell you how many gallons per minute are going through that line from your pool. You want to make sure that the gallons per minute that's stamped as the maximum allowed gallons per minute on the drain cover is more than what's going through your pool pump, because you can still have a safety drain cover on a pool and have it be unsafe if the flow rate through the pump is more than what that drain cover is rated for. All right, and don't forget, for North Richland Hills, the certified pool operator or their designated representative have to be able to respond within 1 hour of being notified that there's a problem on site. So if Consumer Health calls and says, I need the CPO out here, you guys have 1 hour to get somebody out there that can turn off pumps or lock gates or do something like that in emergency situations. This doesn't mean that the certified pool operator can never go on vacation or never have a weekend off, but it does mean that you need to make sure that if the CPO is not available, there's somebody else that's available when they're on vacation and can't respond to be able to come and help if we have a problem. You also want to make sure that you're checking the water chemistry enough to maintain safe water quality, and record these checks at least once per day. The new rules require some types of pools to record those checks more than once per day. So check out the handout on our website, nrhtx.com/aquatic facilities, and it will walk you through exactly what you're required to do for water chemistry and how often you have to record those water chemistry checks. Once you get those records, they have to stay on site for a minimum of 2 years. Okay, and we recommend keeping them longer. And with that, I'm happy to announce that the 2021 preseason pool safety class for North Richland Hills is officially over. You made it! So what you need to do now is the same website where you found this video. Go find the quiz and print that out, complete the quiz, and then email it back to us at consumerhealth@nrhtx.com. That email's at the bottom of the screen. That way you get credit for completing this class. And again, if we can help you at all, just reach out to us and let us know. Our 24-hour emergency number is also on this slide. And thanks for attending the class this year, guys. We hope that everybody has a safe swimming season.